My name is Karin Manuels and I'm a doctor and I'm a clinical sexologist. I work in the Amsterdam University Medical Center and here at GGD, at STI Clinic. And what I do is I supervise nurses this is a nurse-led clinic. It means that our consultations are mostly done by nurses. So that's one part of my job, is supervising them in their conversations about sexual health in general. And I also have a role in consultations about contraception. Me and my colleague, we also insert contraception. So we insert IUDs and we insert implants. I think it's like 60 years or so. 60 more, maybe even more, when they started to invent it. And it's a long history before it was actually available for women. And there were a lot of tests with a lot of hormones and a lot of dosages which were tested. And from that moment on, there hasn't been a lot of changes. There are some changes in dosages and kind of which progesterone do you use. There's some new pills in which you have a new kind of a more natural kind of estrogen, which is in a few pills right now. But the principle has been the same. So you add hormones, and with that you influence the brains, and so they don't make hormones to stimulate your ovaries to develop eggs. And because there are no eggs, there's no ovulation, and there's no chance of getting pregnant. So that the principle has been the same for ages right now, for decades. Of course, we have the IUDs, which are known for quite a long time already. So you put something inside the womb, and the womb is not able to conceive. You were fertile, there was an egg, there was a pregnancy, but because there was something inside the womb, the egg couldn't attach to the womb, and so the pregnancy passes. And then we have the implant. And so that's also a new development from the last 25 years. But the principle stays the same. You add hormones, you influence your brain. It doesn't stimulate your ovaries to make any eggs. The pill is still the most used contraceptive, especially in young women. But there's a slight shift to IUDs. But things change slowly. Yeah? So doctors change very slowly. They're very conservative. There's a lot of options. We have the IUDs, we have the pills, we have the injections, we have the implants, we have the pads, and there's a lot of choices. So if it comes to women, I'm not sure. I would say it's okay like this. When it comes to men, that's a different question, of course. Well, we don't have a lot of men coming with questions about about contraceptives. So it's still a woman thing, and that's what we like to change. And so we try to ask our male clients if they have sexual contact with women. Well, how about contraception? Do you feel responsible for it? And most of the time they think it's a women thing, so they don't join the woman they have sex with in discussing, okay, what do you use? The only question is, do you use anything? Okay, then we don't need to use any condoms if there's no STI problem. So by asking the question, what, for example, how would you feel if your girlfriend would become pregnant, or your one-night stand would become pregnant from you, and you would be a father? How does that feel? And that's a change. It's getting more awareness. They are getting more awareness then, of course. What are the consequences of that? They have sexual contact, and if they don't protect, we try to make them a little bit more aware about that. They have a responsibility in using contraceptives as well.
Is that a goal of the clinic, do you think? Is it something you discuss?
Well, you won't find it in our big goals, but there are accents every now and then, and there were campaigns in the Netherlands about men feeling more responsible for contraception. The one problem is that from history on, it's a women thing. So there's not a big reason to develop male contraceptives, and this is changing because more men feel more responsible for contraceptives. So there's more question for male contraceptive. What the problem with male contraceptive is that you have to, apart from the barrier methods, like condoms, of course, you have to influence testosterone to influence fertility of men. And if you withdraw testosterone from men, it's not that they're not fertile anymore, but they're not vital anymore as well. So it has a lot to do with vitality for men. It's already for years that they were trying to develop a male contraceptive in sense of hormones, and some are about tablets, some are about injectables, some are about pads or creams which you can use. So they're testing it. It has to be reliable, of course. People don't want their sexuality to be influenced a lot by contraceptives. That's the same for men and women, of course. So I think it's not a long time anymore before it's coming. And there are people who say, well, because men are still scientists, and men don't feel a lot of urgency in developing male contraceptives. And if there are male contraceptives, who is going to use it? Will any industry, pharmaceutical industry, profit from it? So those are other questions. And if you are very sarcastic about it, then you probably think this is the biggest reason for it, that it's not developed yet, not available for men broadly yet. Yeah.
One reason I've heard from talking to men and reading a little bit about it is the worry of the side effects from the development of the male pill, partly where you're talking about the loss of libido, but also other side effects. But it brings on this comparison with a lot of women struggling with wide-ranging side effects from their contraceptives, and why should that hold men back from taking contraceptives?
Good question. Of course, the side effects for men shouldn't be more important than the side effects for women. But of course, you want them to be more responsible. Of course, you want them to use contraceptives. If they are afraid of using it, then it won't work. So instead of thinking, well, they don't want to use it, it's important that you make contraceptives for men and women, of course, but for men as well, friendly in their use, in using it. We have to be careful with women, but if you want men to use contraceptives, you have to be careful with men as well. Of course, there are a lot of side effects of contraceptives for women, but it's getting better. I think you don't need to warn them, you have to inform them. But of course, you have to inform the women, but more especially you have to inform the doctors about the side effects and take them seriously. Well, in Holland it's like this. Until your 21st, it's covered by the basic health insurance. But from 18 years on, you have your own risk, as we call it. So it means that if you have any medical care, you have to pay €385 yourself before it's covered by the insurance. So it means that, in fact, young women are healthy women, so they don't have a lot of medical costs. So it means that if you take the pill or any other contraceptive between the age of 18 and 21, you just have to pay for it, because it's always cheaper than €385. But for now, until this hasn't been changed, then in fact women have to pay for the contraception themselves.
Seems a bit unfair.
That's really unfair. That's really unfair.
Because it is quite pricey.
It is pricey.
I personally got an IUD fitted, and it does cost 160.
It does. Yeah.
It goes out of your own pocket.
Yeah. Yeah. So that is really unfair. For me, that's more unfair than women having to deal with the contraception only and men aren't.
Yeah. Do you think society is ready to start sharing the responsibility?
I think so. I think so. Yeah. Yeah. That's not right away. So you have to do more about creating that awareness. So we probably need more campaigns, and we need more creating more awareness when you're talking one-to-one in a consultation. But I think society is ready for it. Yeah, I think so. Yeah, more than ever, I would say. Yeah. But the responsibility for it, you can teach that in an early age, of course, and you have to continue teaching that because then the awareness is getting bigger. The problem is also with what we tell our young people is most of the time we tell them about what can go wrong in sexuality. If you teach them in what can be nice about sexuality, how do you create a nice environment in which you can have nice sexual experiences without worrying too much about a lot of things, then using of contraception comes in your side, because then if you want to have pleasurable sexual experiences, you don't want to worry about, have I got an STI? Did I become pregnant? Did I make someone pregnant or not? So I think with pleasure as a goal from sexuality, from having sexual contact, then the information about STIs and sexual violence, harassment and contraception, it's part of that. If you want to have pleasurable sexual experiences, you are going to take care of all things which can make it unpleasant. And then contraceptive is one of those issues. And then you can make it a female thing, but a male thing as well. And I think it would help women if they would feel that their boyfriend feels responsible for it as well. And there was a nice campaign from Rutgers in Holland. Rutgers is one of the organizations which do a lot of research about sexual health, but they also make campaigns for sexual health things. And there was a nice campaign in which there was a clip in which the boy tells the girl, "Oh well, I need to take care of my pills. So will you help me remind of calling the doctor, so I will get my prescriptions?" And it was really fun because the world was upside down. So it really is a shift when it really needs to change. If men feel responsible, it's going to change a lot, I think, for women as well, because women need to have to trust the men as well about them taking their contraception. So that's why it's important that you share that responsibility, because then you can discuss. Okay, you are responsible for taking your hormonal contraception. Please do, and then the man can say, okay, I feel responsible, so I will be serious about using it. It would really help if you would discuss contraception in a mutual way and an equal way, and so about responsibility. Yeah, I would say, well, women, ask your boyfriends, go start a conversation about contraceptive and just look at the facts. There's female contraception, there's not a lot of male contraception, and ask for male contraception. Raise your voice and ask for male contraception. But I think you have to be glad that there are a lot of options in contraceptives. So that's one. And the other thing, if we come to talk about abortion, I really would like to see that we are more open about abortion and don't think of abortion as something you have to be ashamed of, something you have to prevent at all times. Of course you want to prevent women to have unwanted pregnancies, but if it's there, then please feel free to have an abortion. Make the choice of having an abortion, and don't judge on women who have abortion, and don't demonize abortion. It's not necessary. It's a good option of preventing yourself from having a life that you're not up to yet. So it would be nice if the taboo becomes smaller. Yeah.
Thank you so much.
You're welcome.
For taking the time.
Yeah.